pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone.
Good morning, Mr. Chair.
Motion to approve the minutes.
So moved.
Have a motion.
Second.
Clear my voice. I got a motion second. Any more discussion? Not those in favor?
Aye.
Opposed? Motion carried. Any more additions or deletions?
So moved,
I have
Mr.
a
Chair.
motion. I need a second. For the additions or
I'll
deletions?
make
So moved.
I got it.
Second.
All right. Any more discussion? Not those in favor?
Aye.
Opposed? Motion carried. Yeah, please turn your cell phones on. Yeah. All right. National Correctional Officers Week proclamation. Hello, now you got me. Okay. Sorry about that. Person.
Morning, Mr. Chair, members of the board.
Morning, Sheriff.
So we got a few employees with us today. Jail Administrator Scott McKissick, if you want to come on up, please. Our jail programmer, Tim Brummer, and Correctional Officer Daniel Bart, if you guys want to come on up. So as you're aware, the week of May 5th through the 11th is National Correctional Officers Week, so we want to basically recognize all our correctional officers here locally. So to designate the week of May 5th through the 11th, 2019 as National Correctional Officers Week, whereas maintaining custody of those arrested for and convicted of criminal offenses in a vital public service, and whereas correctional officers have the difficult and dangerous jobs of ensuring the continued detention of inmates in our jails and prisons, and whereas correctional officers perform these tasks on a 24-hour-a-day, 7 days a week, 365 days a year basis, often dealing with violent, mentally ill, and dangerous inmates. And whereas since 1984, our nation has recognized the work and dedication of those engaged in this critical public service by designating the first week in May to honor the work of correctional officers. And now therefore be it resolved in recognition of this event that we do hereby proclaim the week of May 5th through the 11th, 2019 as National Correctional Officers Week in Morrison County, and commend the devotion, contribution, and services of the professional correctional officers who serve Morrison County.
Chair will ask for proclamation.
I'll move on that, Mr.
Motion.
Chair.
Second.
I have a motion second. Any more discussion?
Just want to thank you guys for all you do. I know it goes on up there. My wife worked there for 25 years, and I've got to give you guys credit for all the things that happen up there when people are brought in and how you handle people, and you do a very good job. I thank you very much.
Thank you.
Good job, thank you.
Appreciate it, gentlemen.
All right, thank you.
Are we a photo or yes, no?
Well, I think we could take a photo.
All
We'd like
right.
a photo.
Let's get a photo. What do you think?
I might just hit that one.
We have one more right after this, don't
Oh,
we?
I'm sorry.
We have a
All-
proclamation right after this, don't we?
Oh, do we? Okay. I got a motion and a second. Those in favor?
Aye.
Opposed? Motion carried. Now we got, should we wait for the next proclamation? All right, Mental Health Month proclamation.
Good morning, Mr. Chair, Commissioners.
Good morning.
I have with me today Pam Allard, who is the chair of our local advisory council, commonly known as our LAC, and Vice Chair Karen Miller to present the proclamation for Mental Health Month.
Good morning. So, whereas mental illnesses are medical conditions that disrupt a person's thinking, feeling, mood, ability to relate to others, and daily functioning, just as diabetes is a disorder of the pancreas, mental illnesses are medical conditions that often result in a diminished capacity for coping with the ordinary demands of life. And whereas mental illnesses can affect persons of any age, race, religion, or income, mental illnesses are not the result of personal weakness, lack of character, or poor upbringing. And whereas without treatment, the consequences of mental illness for the individual and society are staggering: unemployment, substance abuse, homelessness, inappropriate incarceration, or suicide. And whereas stigma erodes confidence that mental disorders are real, treatable health conditions, we have allowed stigma and a now unwarranted sense of hopelessness to erect attitudinal, structural, and financial barriers to effective treatment and recovery. And whereas early identification and treatment is of vital importance, by ensuring access to the treatment and recovery supports that are proven effective, recovery is accelerated and the further harm related to the course of illness is minimized. And whereas mental illnesses are treatable with appropriate, effective medication and a wide range of services tailored to their needs, most people who live with serious mental illnesses can significantly reduce the impact of their illness and find a satisfying measure of achievement and independence. Now therefore, we, the Commissioners of Morrison County, do hereby proclaim month of May 2019 to be Mental Health Awareness Month in Morrison County and urge all citizens to work together to break the stigma of mental illness and provide our support to these suffering and recovering from mental illness.
Gentlemen, for the mental health proclamation, I need a motion.
So moved.
I have a
Second.
motion, and I got a second. Any more discussion?
I just want
Go ahead.
I just want to thank you for all the work you do. I know that that's an illness that you can't really tell when you see people, that people do get into moods and stuff, and they just kind of don't know what to do sometimes. So I thank you very much for the work that you do.
Thank you.
And Mr. Chair, if I may, mental illness is not just here and it's not just there, but it truly is everywhere. And, you know, the LAC, I think that's the term, thank you for what you do. It's truly amazing. Thank you.
Thank you.
Thank you
you.
very much.
Very much.
Gentlemen, I have a motion and a second. Those in favor?
Aye.
Opposed? Motion carried. Now we can have photo op. All right.
Now it's full.
Down to the front.
Okay. You're in the middle.
All right. Oh my gosh, perfect. You want my finger for that?
Thank you.
Got it. There you go. And
One more.
Thank you, ladies.
thank you.
Thank you very, very much.
That is funny. Yeah, they're all down.
Get on your knees. We can fill in the back.
I might, yeah, okay.
We good? All right. All right, gentlemen. Thank you very much. Have a good week.
Yes,
Thank you.
Yes, sir. Good job. Thanks, Commissioner. Good job.
See you, Sheriff. Scotty.
That's the first time when all the guys in front were bigger.
I know it. We should have had
Okay.
stools or something.
Who's the airport? Oh, Larry, just showed up. Airport zoning update.
Good morning.
Morning, Greg.
Good morning, Greg.
Just wanted to give you guys an update. The Airport Zoning Board met on April 24th to have a public hearing. We invited all the neighbors as well as those that are in, I'm not sure if you're familiar with what's called Zone A and Zone B of the airport zoning of the crosswind runway. Essentially what we're looking at doing is taking the crosswind runway, right now it's at about 5 degrees off north-south. We're turning it counterclockwise so it's due north and south. And so that's what kind of prompted the update on the rezoning. From there, we'll be sending it to MnDOT for their approval and review. We met with the City Council last night. They concurred with the recommendation from the Airport Zoning Board to send that in. And so this morning we're looking at concurrence from the county as well to send that in. Basically, there's different areas. There's a Zone A, which is right at the end of the runway, which limits what you can currently build. It's similar to what's there now because we're only changing it about 5 degrees. But in that area right below, right adjacent to the runway, obviously you don't want houses or anything like that built in that area. But then you get into the Zone B, which is a little bit farther out. You still can build single-family homes in that area. It limits, you know, if it's like a high-rise or churches or something like that where there's a lot of congregation of folks, because those are the areas that are more prone to accidents if something happens. So we want to keep those clear as much as possible. So in a nutshell, that's kind of what we're looking at doing with the airport zoning ordinance.
So Greg, do you need approval of that?
Yes,
those
please.
changes?
Yep, yep.
Okay.
Concurrence on sending that to MnDOT for their review and approval. We will have a second public hearing coming up here once we get MnDOT's comments back with the airport zoning board, and at that point, then we would bring it here for final adoption.
Gentlemen, will ask for a motion.
I'll make a motion on that.
Second, do we get a second?
Second.
All right, any more discussion?
Mr. Chair, I have a question. 5 degrees, I really don't understand, and I'm not very big on the topic. I'm not very knowledgeable of it.
Yep.
Are you actually physically moving the physical runway that is there?
So the main runway goes kind of northwest, southeast.
Yep.
That's the main runway.
Yep.
Then there's a crosswind that is about right here.
Okay.
We're turning it straight up and down.
Okay, but is that there right now?
The crosswind is there right now. It's a grass strip runway that's tipped, and in order to make it paved and to get it in the right alignment, we had to move it 5 degrees.
And I think that's what answered my question.
Yes.
It's grass today.
Yes.
And you're going to move it 5 degrees, if you will?
Yes,
And then you're tarring it?
that's correct.
Thank you.
Yep.
Any more discussion? Kid, I was at that meeting. It was very informative, Greg. You did a good job. Let everybody speak their piece, and
Yep.
we move on, you know, so that's about all I have. So, gentlemen, I have a motion and a second. If no more discussion, those in favor?
Aye.
Opposed? Motion carried. Thank you, Greg.
Thank you.
Thank you,
Thanks,
Greg.
And Brad, it looks like we got Penny and Brad. Social Services report.
Good morning, Mr. Chair, Commissioners.
Good morning, Brad.
Morning, Penny.
We'll have a couple other guests joining us. We have a couple other things to talk about other than what Penny has on her thing. So her report, so she's going to talk a little bit about her report, about the LAC report, and then we're going to talk a little bit about employment for mental health folks. So I'll turn over to Penny for her first report.
Sure, thank you. So the first report I'm going to talk about is about our adult mental health case management that's offered through the county. Case management services for individuals with mental health is really that connective fiber that gets services that a person needs in order to live as independently and successfully in the community as what they can. So the case manager pulls together all the appropriate supports and services. When you look at our first statistics here, it shows us the number of individuals that Morrison County has been providing case management to. You'll notice that there is a steady increase in the number of people. And I think that's good. I think it's good that people are coming out and asking for help and utilizing the services there so that we can be proactive on the front end instead of waiting to be reactive for crisis when they happen. If you notice the yellow, the very end bar for each year, that's the number of current assessments. There's a dramatic increase in this last year, and that directly correlates to the work that we're doing with our jail social worker. So all of those in assessment still, from 14 up to 62, that is directly that jail social worker. That's how many cases she has open right now.
Oh, wow.
So, but the increase from 168 to 207 does not have to do with jail social worker. That is simply our adult mental health case managers supporting individuals. So a large increase already that we're seeing this year.
Mr. Chair, if I may, Penny, do they come to you, or do we get a call and then we open up an investigation? If I'm saying that the right way?
Sure, there's a large different ways in which somebody may be connected to a case manager. They may walk in and say, I need some help.
Okay.
And so we get them connected. We meet with them and get all their eligibility criteria that they need. They may already be seeing a therapist, and the therapist says, you know, I think we could use a little bit more. You could use a little bit more than just me to support you. And so that therapist will make a referral over to our county and have us meet with them so that we can add in additional services besides just therapy. We do have some of these that come through on a commitment, a civil commitment. and then choose to remain open with us voluntarily after that commitment ends.
So there's many different ways.
Absolutely.
It's not just I walk up to the front desk at social services, or just that you get a phone call. There's many different ways. Okay, thank you.
Yep. We continue in Morrison County to examine the cases that are coming in to make sure that they're being appropriately served. We partner with Northern Pines Mental Health Center, who also provides case management through their CCBHC model of service. That model really attends to
What is CCBHC? I know what it stands for, but what does it stand for? CCBHC.
Certified Community Behavioral Health Hospitals.
You do know what that's?
Do you study that stuff at night?
That's the only acronym I've ever known.
They're one of 6 in the state currently, Northern Pines
Which they
is.
may not exist after this year, so that's a possibility too. so.
Right, which will impact our case
Right,
management, because right now
exactly.
they average between 25 to 30 cases that they're doing case management for individuals specifically who may be co-occurring with chemical dependency and mental health, or physical impairments and mental health. So that would be a change for us. If that goes away, we would need to look at absorbing then those cases.
Ignore that, Peggy. Just ignore that.
I'll just keep going.
Yep.
Yes. So I talked just a small bit about the civil commitment process, and the next diagram shows that the numbers of civil commitment also dramatically increased in 2018, from 12 in 2017 to 19 in 2018.
There's no necessary explanation for that, is there?
There's not, I don't have anything specific that can say, here's why. We just know that people were struggling.
Yep.
Currently, we have 16 individuals that we're supporting through the civil commitment process. The next slide shows the revenue related to case management. We've consistently increased that revenue base, and we are on track to exceed last year's revenue already, just looking at the first quarter of this year. It's important to know that we continue to see that increased revenue, even though we're continuing to see increased number of cases, because number of cases directly correlates to the rate that we're provided by the state to provide targeted case management. The more the number of cases goes without a proportional increase to staffing, reduces the rate. So down just a bit, I show the TCM rates. 2017, we were at $390 per month per client. 2018 was $390, 2019 is $378.
I would just make note that if you notice the blue bar, that is our medical assistance reimbursement, which is tied to our membership in South Country Health Alliance. If South Country Health Alliance, as you know, we will be done with them in December, and we will be procuring for new health plans in 2020. All of those plans also are required to provide medical assistance for mental health case management. So I thought I'd point that out if you were wondering, given the pointing out that it was South Country Health Alliance. So what that might look like or what the rates would be with them, we're still yet to be determined. Most of them do go with the targeted case management rate, so.
Mr. Chair? Penny, the diagram or the list that you have in front of me from 2014 to 2019, from 358 to 378, where does that money come from? Or how, can you explain what that really is, that TCM rate?
It's an MA rate that we're
Medical,
provided,
okay.
or through South Country Health Alliance.
Okay,
So basically, it's a benefit set for health insurance.
gotcha, thank you.
So medical assistance is our health insurance
Yep.
for lower
Thank
income
you,
or
I just didn't
disabled.
know. Okay.
The other thing about our rate, our revenue in 2019, that's important to note is that back in July of 2018, we started a pilot for that dual model, targeted case management and waiver case management. And so that model reduced from a caseload of 40 down to 20, but provided both sides of case management with one case manager instead of a person having to have two separate people, this person over here attending to waiver services and this person over here attending to mental health services. We collaborated that into one case manager, but they were required to do both plans, all of the paperwork and requirements for both services. We've seen an increase, when I ran the numbers just for that one staff, an increase of her numbers from Q1 of 2018 to Q1 of 2019. There was an increase of about $3,500 revenue for that one staff in that pilot project. Other questions about revenues and rates?
Mr. Chair, if I may.
Go ahead.
Not so much about, well, the revenue numbers or the revenue increases could be tied just to the number of cases, that the increase in number of cases, correct?
Correct.
Could.
Okay. So the question that it really was after, so, and you know, we have all the graphs and the numbers that way, but especially when your reference to we could possibly lose Northern Pines as a healthcare provider in this sense, correct? Or
In part of the sense, they'd still continue to provide mental health services, but their ability to do a broader array of services might be challenging if CCBHC is not allowed to continue.
okay, so my basic question then is so within the county here, how many employees or how many FTEs do we have that work directly with adult mental health?
4.3 right now.
4.3. Okay, thank you.
If I may, to piggyback on Commissioner Blaine, if CCHB pulls out of helping out with mental health, you brought up that someone's going to have to pick up that dollar figure, maybe the county. I know you didn't say that, but is that where we're going with this possibly?
Well, what we'd have to do is have that conversation with Northern Pines about what they're going to continue to do after July 1st, what they'll continue to do, and what that might look like, and what portion of those may be interested in continuing case management. So it would take some conversation with Northern Pines and our agency to decide how can we meet the needs of those individuals, given how they're going to be operating after July 1st if they cannot continue to be a CCBHC.
And it just wouldn't affect Morrison County, it would affect
All of their 6 counties, yes.
Our Region 5 Adult Mental Health Initiative has a longstanding relationship with Northern Pines in providing targeted case management to the region as a whole, even before the CCBHC was implemented. So I would venture to guess that the relationship would continue, and the AMHI would continue to look at it regionally on how to support that.
Thank you.
Mr. Chair, and for clarity, with the county severing its ties with South Country at the end of this year, it is really DHS which will set the rates for whoever the provider is that we look to do business with in 2020 and beyond, correct?
I believe when it comes to an individual benefit set, such as a case management rate, I don't know how much say the state will have other than what is statutorily required under medical assistance.
Okay.
So, but that's negotiated during the procurement process
Yep.
between the health plans and the state.
Yep, that's correct. Yep. Okay.
So,
The next graph that you'll see is the CSP grant for 2019-2020. Morrison County was again awarded the $659,000 for the 2-year grant period. These grant dollars are broken down into a number of different areas: community education and prevention, transportation, supporting the drop-in center, supporting supported employment, basic living and social skills services for those who are uninsured, as well as case management for those who are uninsured. For the first quarter, we are at 13% of 13% for the grant period of spending. You'll notice that we have had a reduction in supported employment, and this is due primarily to an increase in the waiver availability and also an increase in the IPS program, which you'll hear a little bit more about later. But IPS is an evidence-based practice that supports employment, rapid access to employment for individuals with mental health to help find the jobs and then support them in the jobs. The case management area also will support the jail social work position at this time. Some other mental health updates and information. We continue to watch the county cost share that's related to individuals who are civilly committed and receiving state hospitalizations through either a NOCA or a CBHH, Community Behavioral Health Hospital. From the date that an individual is at that facility and determined to not meet medical criteria, those costs come to be a county cost per day. So we have experienced some of that coming out of ANOCA for this year in 2019 already. None through the CBHHs or Rule 20 yet for 2019, and hoping to continue to maintain that.
Penny, what makes a CBHH, or where are they, or who are they? Or are they close by?
They're the state hospital facilities. So ANOCA is the main regional treatment center for mental health. And then community behavioral health hospitals, there are
7?
I was going to say 6. So somewhere in that neighborhood throughout the state.
Yep.
Okay.
Yep.
We do have one in Brainerd, but it all depends on if there's a bed available.
Yep.
And I know that these are topics that are near and dear to commissioners' hearts across the state because of the cost shift that has occurred, especially around those that are determined to be eligible to be discharged, but yet they don't let them leave, but we're now charged 100% of the rate. So we have done a very good job of managing that, both locally and as a region. 2019 is a blip, hopefully, that will not continue, but I know it's one of those issues across the state that we've been trying to address.
Well, that one, again, if I may, that it costs the county, some of them $100,000 a year per patient.
Yep.
We've been really fortunate through our adult mental health initiative to have hired a transition specialist that supports this work in discharging individuals out of community behavioral health hospitals in ANOCA. Beginning of 2019, we just happened to be in a transition period in that position, and so that was hard for us. But she's back up. The other interesting news is that I've been sitting in on the DHS case management redesign policy team, initial design team, and the fiscal team for about the last year. And so really looking how case management right now, there is just a plethora of DD case management looks like this, and adult mental health case management looks like this, and children's mental health case management looks like this, and child welfare case management looks like this, and waiver case management looks like this. So there's an array. And really, case management can be case management. Our job is to connect people to services. So really looking at how that can be defined and aligned more closely, and how that rate can have a reduced disparity across the state on how it's funded. So.
And we've been appreciative of Penny sitting on that, and I know the state had as well. And one of the things she said at the end about the rate, so we get $390 per hit. There are some counties that get like $1,600 per hit per month. So there's quite a disparity between counties, and really not a logical explanation by the state or the fiscal division about what's in that disparity. And so, and I know the federal government has been looking at that and trying to better align the rates across the state. So it's a pretty deep topic with lots of stakeholders and concerned individuals. So,
Penny, what you just got done saying, what I took from that was the group is looking at a much more streamlined, very matter of fact, if you will. It's what is planted in my mind. Very matter of fact, we're all doing the same thing.
Absolutely. How do the activities of social work, of case management align regardless of the person's disability or impairment or challenge that they're faced
Absolutely.
with? How are those activities aligned across social work?
Thank you.
Mr. Chair, if I may.
Commissioner Blaine?
Penny, you talked about a $659,000 grant, and we've talked in the past, Brad, and your department, how the importance of this grant money to in providing services to those in need here. I'm just curious, when we receive a grant like that, are we able to utilize some of those grant dollars for staffing, for administration of these programs? Is there guidelines that are set down in that grant procedure that limits that, the percentage of the grant dollars that can be used for personnel and administration, and a percentage that has to go to, and if that is, can you expound on that?
Well, it's a yes to all of that, but the nice part is that there is some flexibility in the grant that we do pay for, as Penny mentioned earlier, part of the salary of the jail social worker that isn't covered by other grant dollars is covered. Social worker time for case management, that's not covered under medical assistance, but it also helps fund our drop-in center, our CSP program, our community support program for individuals, and so Penny works with the state. It's a 2-year grant that we receive every year. They give us the allocation, but then we have to align that with our fiscal reporting, how we're going to spend that amount of money.
Okay, very good. Thank you.
We're waiting.
Okay. Next up, I will have Ms. Pam Allard and Karen Miller come on up for our local advisory council report.
And as was mentioned earlier, that's the president and the vice president of local advisory council. And I think Penny's going to speak on their behalf a little bit just to share some of what's going on with the local advisory council.
So just to give some background information, the local advisory council is made up of individuals with living experience of mental health, family members, some mental health providers, Northern Pines Mental Health Center, as well as Nystrom's, as well as Oak Ridge. I'll sit on the local advisory council. Our year in 2018, the local advisory council was able to do mental health first aid training, was offered twice within our county. We did an empowerment training with the national presenter, Annie Meehan, as well as the mental health fair is done every other year with the drop-in center hosting, and the drop-in center hosting skills groups twice daily there at the drop-in center. So a number of educational components throughout the county on mental health and trying to reduce the stigma. Another area is housing. This can be an incredibly challenging area of living for individuals with mental health. We have LSS Housing Services come into the drop-in center the third Thursday of every month to help people fill out applications and secure housing, as well as having the housing resource guides available. And then the last area that was focused on in 2018 was our crisis intervention, really trying to provide information materials on the crisis line and referral services throughout the county. In 2019, the LAC's goals, we did some extensive work on updating the bylaws and really supporting creating a strong regional LAC and a presence in that LAC. We invited Northern Pines to join as a mental health professional role into our local LAC. For education, we have offered a co-occurring chemical dependency and mental health training. That's already happened this year. We will also be offering mental health first aid training in towns outside of Little Falls. So in 2018, we started in Little Falls. In 2019, we're going to bring it out to Piers and Swanville, Upsala area, and just broaden that to make sure everyone has an opportunity in their local area, as well as looking at a PTSD training. The housing, Greg and Rose from Oasis will provide training at the drop-in center on available services and homelessness. And for the crisis intervention area, we're looking at the crisis line, warm line presentation at the drop-in center, and we're really promoting that regional website for resources throughout the county. It is important to have a regional connection into LACs throughout our Region 5. Karen and Pam, I know, have been just so instrumental in making sure that that's happening, that not all counties are as dedicated as they've shown to be, and I really appreciate their attendance in that and bringing that back, having a voice for Morrison County up in that regional LAC.
And part of the role of the LAC, the Department of Human Services, looks for consumer input when we're talking about mental health services and regional programming and local programming. And so they're also instrumental in talking about what meets their needs and what will support individuals living with mental illness. And so really appreciate the role they play in that as well. So, anything you two would like to add?
Not that I can think of.
They did all the talking earlier, so thank you.
Mr. Chair, if I may,
Commissioner Zalinski.
can anyone expand just a little bit on housing? Housing has been talked about at this board, has been talked about and is talked about regionally. Housing is talked about nationally. Can you expand just a little bit on housing that you deal with here in Morrison County? Whether Penny, whether it's you or Brad or our LAC members, just explain to me a little bit about what you deal with housing.
So I think that housing really, there is a shortage. We all know that. We do have some programs through a number of different providers that can support individuals with mental health. Our Bridges application program, which is a bridge to our Section 8, it is for individuals with mental health only to try and bridge that gap and get them connected sooner into affordable housing. We know that if housing is not stable, it can dramatically impact a person's mental health. So someone who is already challenged by some mental health symptoms, if they lose their housing or don't have housing, that's only going to exacerbate those symptoms and create all kinds of other challenges and struggles. So the other services, LSS, specifically provides services to individuals with mental health who have a case manager. So a specific service for individuals with mental health to try and support them in filling out applications and getting connected, because sometimes mental health symptoms can impact their ability to do those things. So if we can support them in getting those applications filled out and looking for housing through those services, that's been helpful.
Very good.
I think one other thing, Northern Pines is people who help move people has really helped out. I noticed a lot.
Absolutely.
They are number one in my book.
Very good.
Perfect.
Thank you. Thank you very much.
One other thing we'd just like to talk about, and that is IPS services. And one handout did not get in your board packet, and Tabitha has that for you.
Thank you, ladies.
And I don't know if Julie wanted to come up or if Penny would just talk on her behalf, but I think one of the
I'll bring her up. Yeah.
But one of the new and innovative programs that Morrison County has been able to partner with Productive Alternatives. So maybe if you just want to introduce yourself, Julie.
Julie Petershek, Productive Alternatives.
And
Andrea Earhart, Voc Rehab Services.
Good
So-
morning.
Good morning.
as we talked about in the report, evidence-based programming, IPS, is individualized placement services, and it's a partnership between our agency, Productive Alternatives, and DEED, Department of Economic Development, or Department of Employee and Economic Development.
There you
So, and so one of the expectations of this evidence-based program is to bring it to decision makers such as you, and so we've not been good about doing that. So today is one of those efforts to put forth to share this quality information with you about what we're doing to try to help create stability in income by employing individuals with mental illness and supporting them in those activities. And so I'll turn it over to Penny or Julie, who would, I don't know if they would like to, what they'd like to say, but I think it's been a critical program to support persons employed.
So I think today we're just going to kind of bring you up to speed about what it is when we started here in Morrison County and where we're at. So IPS was launched in Morrison County in 2015. As a mission, it really fits in with our mission, social services mission, to provide necessary resources to individuals to strengthen their self-sufficiency. Right? Because if they're employed, they can potentially be more self-sufficient. This year, January 15th through 16th, we had our third fidelity review with the state, and again, received a good fidelity rating. The state reviewer's comments even specifically said that there's a very clear commitment in Morrison County to the employment as part of recovery by all of these partnering agencies with our IPS program. So that was really nice to see. I just talked a little bit about how research really shows people with mental health, how positively impactful it can be to their mental health symptoms to be employed. When we look at the numbers, 2016, there were 21 individuals served by the IPS program. 2017, there were 32 individuals, and 2018, we had 42 individuals.
And this is in Morrison County?
In Morrison County. So the project continues to grow. And this is really phenomenal, especially given over the course of these last 3 years, we have had some employee changes, and yet the program continues to grow. In 2018, there were 27 people that were competitively employed through this project, and I think that's just really phenomenal to see. Other things that either of you would like to add?
Well, I guess I'm thinking you guys probably don't know a lot about our employment services in general, so the thing that I always really like to say about IPS is that it's really about access. When you look at the difference, I mean, we've always done employment in Morrison County. You've always been progressive and supportive of people with disabilities working, but IPS is like a niche service that really focuses on meeting people where they're at, giving access in a way that the system didn't used to allow for. So for example, if I look at how things were, I've done this for 25 years. If I look at how things were 15 years ago or even 10 years ago, many of the people that are working and were serving in IPS wouldn't have even made the cut in eligibility for services. Not that they wouldn't be eligible, but there would have been a lot of hoops for them to jump through before we said, yep, we're going to work with you. You know, because we would have wanted a lot of things in place. And now IPS, I mean, the most basic takeaway of it, in my opinion, is just if you say you want to work, we're going to meet you where you're at, and we're going to figure it out. How do we get you there? You know, and we're going to try and work through your symptoms. We're not going to try and wait till they're gone, you know, or till you're stable. We're going to say work is going to help you be stable, and work is part of therapy, and it's going to help you be successful in what you're trying to do. And I think that's to me, that's the key, you know, and having done this as many years as I have, it's you're really trying to put things together for people in a way that the ultimate goal is work, and we all believe that, and we're trying to get you there, so.
And I think the prior employment services and current employment services outside of this don't allow the intensity that this particular program allows, because individuals with mental health struggle with some day-to-day functioning, and so this can support that. It supports employers in working with those individuals and providing them knowledge or skills to work with the disability they may bring to their organization. So that's really, I think, what we're saying is that no matter how difficult it is for you to function from day to day, we're going to support and help you get there so you can be employed and become more self-sufficient. So
I think the collaborative effort that's brought through in this program has been very helpful as well, that the case manager and the employment job coaches and specialists and Andrea are all at the table every other week, reviewing how things are going with everybody. Every other week, they're sitting at the table together. So.
And if I missed this, maybe I did, does the employer get subsidized or anything like that at all on this?
Sometimes, not in a way, if, we don't know about that always. I mean, there used to be, you know, some employers would do like a tax credit. We haven't facilitated any of that in a long time. You might be able to speak more to that, but for the most part, we're not trying to sell it as a, you know, as a subsidy. We're selling it as we have a viable workforce, And we believe that the people we're serving are, are an asset to you and can be. And so we really try and focus on good job matches and, finding things that are compatible, the employer's need versus what the person we're serving skill set is. So it's really not about the benefit, financially to an employer other than that you're going to get a good employee, and we
point.
try and put the support in place, that would help that happen when it's needed. And it's not always, our supports could look a lot of different ways. Sometimes it might be a job coach on site that's helping the person kind of do the job. Sometimes it's, we're going to talk to you before your shift and work you through whatever anxiety you might be dealing with that day. So it's really just about good job matches and,
Thanks for that explanation.
Yeah.
Thank you very much.
Mr. Chair, how do people find you? I'm sorry, but I don't mean that,
Nope.
maybe the way it came out, but.
That's
do-
not an uncommon question.
I'm struggling. I don't have a job. I
Yep.
have a few issues, whatever they might be.
Yep.
How do I find you? How do I get in contact with you?
Yep, so we're a vendor, and we're a nonprofit, a private nonprofit, and so what that means is, we really rely on referrals and our connectiveness with the community. So for example, Voc Rehab is a huge partner for us. They purchase our services. And so when somebody calls us and says, hey, I want a job, I'm looking for a job, we're going to try and route them to the right place that they probably will end up coming back to us. Not always, but most times. And then, so in a typical day, Voc Rehab would cover the upfront costs of our services, and then we partner with Morrison County. They purchase our long-term services, to support people on the job. Now, in IPS, as an agency, I write a grant that kind of funds the positions, and then the rest of it kind of partners together. Andrea, her department, her company pays the state of Minnesota for some of the placement agreements. And it gets to be a little, I guess, complex. But at the end of the day, we're a vendor. If you want to find us, if you're looking for employment, if you have a county case manager, they're going to know about us. Voc Rehab knows about us. Many people come to our door, and we reroute them.
We review every adult mental health case every 6 months.
So what this
team.
is this streamline effect, if you will.
Yeah,
rapid engagement. And because you folks all work together once a week, once every 2 weeks, once a month, whatever it might be, because of the streamline effect, I probably would be in contact through Morrison County Social Service. Thank you.
Yeah.
Anything else, gentlemen?
Great.
Fantastic.
Thank you very much. Good information.
Thank you very much.
Oh, you put your
Bill
other
Gates,
hat-
you're not, right?
You get to put your other hat on, Brad?
Yes, we're going to move to the public health report. I'm going to ask Cindy and Karen to come up. So one of the important programs we have in public health is called the Child and Teen Checkup Program, critical to keep kids healthy. And so Karen and Cindy are intimately knowledgeable about this program, so they put together a nice PowerPoint presentation to share about some of the statistics around Morrison County kids and families. So
The Child and Teen Checkup Program. So the next slide. So what is the Child and Teen Checkup Program? So Minnesota's name for the program is the Child and Teen Checkup, which is the EPSDT program, Early Periodic Screening, Diagnosis, and Treatment. So it's required under Title 19 of the Social Security Act, and we provide services for children birth through age 20 on medical assistance. And so a breakdown of exactly what a child and teen checkup is. Basically 4 breakdown of components. We've got our screening, diagnostic, treatment, and referral, and they're all very critical and very embedded. So under screening, we provide the physical, mental, developmental, dental, hearing, vision, also the physical, mental health, growth, development, and all that includes. For the diagnostic, a diagnostic testing is a follow-up when a health risk is determined or assessed. The treatment can be for vision, hearing, oral health, many components. The referral process is when a referral is indicated within a child and teen checkup, and they need to go on for further diagnostic testing. And we as a program, and that is part of my job, is to do a referral follow-up on families to make sure they're accessing the services that they need. And on to the next slide. The periodicity schedule, this is kind of our Bible of the program. It's where our clinicians can resource this. We have the hyperlinks within this, so the clinicians can hyperlink into all the screening fact sheets. It brings them into the recommended instruments and requirements for vision, hearing, all those tools. Also state mandated to help them with MDH can do for their trainings that are necessary. So it's a wonderful tool, and it's what we work off of within the program.
And I'd just like to say, when she says clinicians, family doctors, people at the medical center, we work closely with them to make sure they're getting paid for all of this work that they're doing with these kids, because they're better reimbursement for our clinicians, our doctors, if they're following the child and teen checkup guidelines. And so when she says clinicians, it's our family physicians and our local doctors.
Right, thank you, Brad. It's important to note, too, that for a clinic for a child and teen checkup to be recorded in our participation rates, it has to be a complete, full child and teen checkup. So if a component is missed, it doesn't come through to us as participation within the program. So it's also, as Brad stated, very important on the clinic level for them to meet all the components for the full reimbursement rate of their clinic. But most important, it's important to the members that they get the full benefit of a very comprehensive screening. And our child and teen checkups are very comprehensive and meet many requirements. It can cover a sports physical, it can cover a camp physical, it covers all those components.
Mr. Chair, can I ask, Karen, does that funding flow through you, or do you release it, with other similar programs, or is that something directly with the provider and the state?
Right, we are contracted out through the state, so we receive $26.50 per child in our grant to oversee the outreach. So we're collaborative. We work with the clinics, we work with the health plans, we work with MDH and DHS, and then we work with the families. So
make sure
we oversee
we're-
the program.
Okay.
And then the clinics then bill out their services and receive their funding and dollars through that process.
So we're the coordinating or education and all of that, and they deal with the reimbursement directly with the state? Okay.
Correct, yeah. How often do children get in? So again, our screenings are very comprehensive, so between birth and 1 month, then several checkups between 2, 4, 6, 9, 12, 15, 18, 24. That 30-month is new. It was added in 2017. We're in alignment with Bright Futures, which is also a federal program directed by our Pediatric Association. We realized there was so much growth and development between the age of 24 months and 3 years, we needed to add that additional checkup. And then another change in 2017 was every year. Although we looked at that within our program and we encouraged yearly checkups, we are now accountable for those yearly checkups. And when I say that, I mean it's reflective in our participation rates. So the expectation is that these children and young adults will get in every year, which during these growth and development years is very critical for them to get in and be seen. So on to the next slide. This kind of oversees kind of what that process is. So I went back over the last 7 years just to give you an idea of where we're at with state. The federal goal is 80% participation. The oranges you see will be the Minnesota state rate, and then the blue is where we are at in Morrison County for participation. So we worked very hard to get our families in and to meet that component. In 2009, we were at 78%. And then they revamped the reporting process and how they established the data. And so you can see we had a rebuilding process in 2010 and 2011 and began over. We're going to have that same effect now in 2017 and 18 with the change in the program requiring those interperiodic and more, and the 30-month. And so on average in Morrison County, we have about 3,600 children. For the year, about 4,000 or over. And those are families that come off and on the program, new to the program. So it's a challenge to make sure our families have all that information, and we work hard to make that happen. On the next slide, this is the CMS 416. We look at this for quality improvement. We really target our age groups. It's broken down into percentages of children and who's getting in and who's not getting in. So this is a huge tool for quality improvement within our program to really define where our outreach needs to be, our education needs to be, where we need to work with the clinic at, and our families at. On the next slide, we talk participation rates and what it means, and it's, again, more than just children, or just more than the state participation numbers. It's about children getting in. And when we're doing well in our county, then we're seeing that reflected in our immunization rates. And so you can see above the dot is the state rate, and this is the adolescent immunization summary. And you can see that we're above state average for immunizations, which is critical. There's a lot of conversation happening in regards to MMR. And so it's nice to know that for the state of Minnesota, the state rate for adolescent immunizations at 79%, Morrison County is at 92%. And again, that's targeting your MMR, but that's a very critical vaccine. So overall, we're doing very well. And our adolescent immunization, and on the next is the childhood immunizations. This captures birth through age 2 years. And again, we're doing very, very well. Again, the state rate for MMR right now is 79%, and Morrison is at 92%. And so there is a gap between that 2 year and 6 year where kiddos can still get in and get additional immunizations, but at 2 years, we're doing very well, making sure that the kids are getting in and the clinic is coding them and having them get in. The next slide is also lead. Lead is another important screening component that we have within the Child and Teen Checkup Program. And so always working very hard in that area to improve those rates. We do offer leads at WIC, but mostly those are done at the clinic level through the clinicians, and a key factor in the testing. So working consistently with that. On the next slide, quality improvement. And again, I've been in the program since 2003, and I've had some questions from our health advisory and some of the committees, what work goes into the program. So it was kind of room for pause to go back and look at a few things and see where our investment in the community has been. So I looked back, and phone contacts has been over 23,000. Outreach attempts over 108,000. Referrals, when it's identified that we follow up on, is close to 1,500. Foster care outreach, which is something that we do that makes sure that they're in placement, we get the information back, has been high, but the total amount of screenings that have been accomplished, coded, and completed in the last few years has been over 40,000. So as we move to the next slide, that's bringing value to the CTC program. That's kind of what it is, a healthier community. That is what it is making sure that our families have access to good health care. Their screening components are met, the testing is being met, and we have a healthier community because of that.
And Morrison County has always been fairly high in immunization standards and child and teen checkup rates, and it's a testament to, I think, the staff of public health and what they've done to partner with the clinic and the physicians and educating them on changes to this particular program, because this is what we are evaluated on, are they meeting all of those thresholds of the child and teen checkup program? And so we do a good job in partnering, educating, and supporting each other.
Yes.
Gentlemen, any questions for him?
I have a question, Mr. Chair.
Mr. Lemire.
The immunization issue is a big issue. You see measles popping up, and I was just curious, can you go to school if you're not immunized?
In the state of Minnesota, yes, you can conscientiously object. The school does not have a right to keep someone from school because they've chosen not to immunize, so parents do have the right to make that choice. However, we could be directed by MDH in the event of an outbreak to tell children that are not immunized that they need to stay home. So if there was an official outbreak of measles or any other communicable disease, the children that have not been immunized, per conscientious objection, not children that medically can't get a vaccination, because there is a difference.
Yes.
But people that have conscientiously have chosen not to be vaccinated can be told they can't come to school. And that would be a directive not from us as a county public health, but from the state.
Okay. Because even them state averages that we're above, thank goodness, I think that's horrible, 79% for measles and mumps. And but thank you for the job you do, and Morrison County seems to be doing a very good job on getting our immunization
An
to our
additional
children.
note on immunizations too is we deal within the MIMVAC program, the Minnesota vaccine, which is definitely a benefit to our families, and they qualify for that. So additional vaccines that aren't school required are available for your teens and young adults.
Very good.
So your pneumococcal, hepatitis A, HPV, Tdap, all those are incredibly expensive off the program and are made available to our families within the program. And so that's additional huge benefit for our families.
You know, these are people just on MA. They're not, because there might be other families that aren't on MA that may not be vaccinated also.
Correct.
Correct.
Well, absolutely.
Correct.
I
So this is our
understand that, yep.
population, yes, that they qualify for that.
Anything else, gentlemen? All right, thank you.
Thank you very kindly.
I have one other item under public health. We have 2 seasonal food, beverage, and lodging renewal licenses, as well as a new owner food and beverage license. Facility in Randall is going to reopen, so I have those before the board for approval.
All right.
Motion to approve, Mr.
I
Chair.
have a motion, I need a second. Any more discussion? If not, those in favor? Aye. Opposed? Motion carried.
That's all I have this morning.
Thank you, Brad. Amy, Land Services. Then we'll take 5 after Amy. How's that sound, gentlemen?
Sounds like a winner. Good morning, Amy.
I just have one item for you today, and that is to consider the conditional use permit application from Knife River Corporation. And this is to establish a temporary asphalt plant within 660 feet from a neighboring residence. This was recommended for approval by the Planning Commission with one condition, and that condition is the property owner or pit lessee shall apply water or calcium chloride on 275th Avenue for dust suppression during asphalt hauling. Also, the property owner or pit lessee shall meet with Boone Township officials before and after asphalt production to review the condition of 275th Avenue and shall determine the restoration needed. The property owner or pit lessee shall complete all agreed upon restoration after asphalt production is completed.
Gentlemen, I need a motion, a second for more discussion.
So moved.
I have a motion, I
Second.
need a second. Any more discussion?
Mr. Chair, I have a
Commissioner
little
Zelinski.
question. Regarding the water and the calcium chloride, would it not be a whole lot easier to calcium chloride that road versus water? The reason I say that is, today it's dusty and tomorrow it's not. The water truck's there today, but it's not there tomorrow. And if it's dusty, does that mean that operations cease? Because that's what it says. That's a part of the commitment to the CUP. So I would simply ask, why wouldn't we just calcium chloride the thing and it's done?
Number one, Commissioner, it's a dead-end road.
I
You know,
realize it's a
so-
dead-end
So
road.
it's, I don't think, the traffic is always on there. It's just that this crusher, or whatever they're putting on there, they're still going to haul regardless this is going to be there. It's an open pit right now. It's been
Yep,
never,
100% correct.
So, and the township never, they made a motion that, they are fine with either one of them.
Good enough.
That's my opinion. I mean, that was what was said, so.
The board certainly has the ability to tweak any condition, so if
And a
that's something you'd
township
like to
member
change.
did come up and speak to that effect, and he was fine with either or. Any more discussion, gentlemen? Not those in favor?
Aye.
Opposed? Motion carried.
That's all I have. Thank you.
Thank you.
Amy, have a great day.
Thank you, Amy.
Let's take 5, gentlemen.
I don't know if it matters. I
Ladies.
don't know if you can see it.
That was nice that the township was there to represent that.
Thank you.
I can stretch these and screws.
Yeah. So, do you want to call, do you want Jesse to call? I think the options are either number one, which we could do an option, or she can get the check and she can put the check into our account, and then after the event and everything's good, we can reissue the money. Or they can give us a certified check, which costs them, even I don't think it's that big of a deal. Or if you want to get and accept just a regular check, you have to vary from that and acknowledge that that's what we're accepting, knowing that that is something we accepted for them. It costs them. That will be the case, and you certainly can look at every application individually. So I think those are the options, and so they're valid options. Okay, totally, yeah. So I would just, I would think that was just. Well, that's what I said. But in the past, it wasn't a certified check. No, good catch, yeah, exactly.
We weren't costing it, we weren't reissuing a check. Right.
No, I don't think so.
Well, they would have to,
They have to upfront, they have to upfront money for
Right,
it.
but he's stating like when we send it back, so then I told Jenny, I said, you would have to contact your bank, ask them how I would take that check back. Could I sign off of it for Morrison County and then they sign, I mean.
But that would take, we can do it, we have been doing, it's just a matter of then we just need to make sure we're acknowledging that that's acceptable and
doesn't actually make them, or just make this valid.
I can spot.
It's out in the car, actually, so I don't want to walk the car. Seriously, I left my wallet out there. Why I did that, I don't know. Maybe I knew you were coming or something.
You knew I was coming.
I'll tell you what, check will be in the mail, how's that sound?
Okay.
Give me your answer.
18.
Must we take a picture for it, or we need to have
Well, we need a comment, we need a picture too.
We need Mike too.
Gosh.
I'm thinking Mike's in. Before we go back to business.
Let's go. Let's get this.
Did you read this?
I don't care.
He did. Happy with everything? Are you happy with everything? So,
Well, we don't need.
you don't mind if I ask you, so Bob,
The original 140 acres.
okay.
All right, gentlemen, let's continue.
I'm happy for that. That's the way it should work too.
If you do, you pay Charlie $18.
Next on auditor's report.
Morning, Chelsea.
Good morning, Chelsea.
Good, how are you guys? Good.
Thanks, Charlie.
Yep, thanks.
I'll be digging.
Hey, Charlie, leave your address someplace too. I'll send you something. Go ahead.
Thank you. Mr. Chair, if I could just give you an update on elections and where we're at on legislation. Back April 18th of this year, I met with Secretary Steve Simon on election topics. And
we kind of dove into a couple of files that are on the table for county choice of election equipment, security money that we have that we're not able to utilize right now, and then also data privacy with the presidential.
You said securing money that we can't use?
There's money right now, security money for the
Right.
state of Minnesota that is being held right now that we haven't had the ability to utilize.
So why are they holding it? Or are you getting to that?
Well, right now, there's a bill on the table
Okay.
that they're working on.
Answers my question. You're
So we
good.
can utilize that money. So I just wanted to give you an update that I met with Secretary Steve Simon on April 18th, and then yesterday, I was able to have a conference call with 4 other counties, Washington County, Todd County, Wright County, and Cass County, with Senator Paul Gazilka to stress our concerns with our county and our hopes that's at the table right now for these topics. So just wanted to give you an update, and I can certainly send you House files or Senate files so you can follow along. Because it does weigh in quite a bit, even though it's not an election year for us in the county, you know, because we have the off years, we're still doing quite a bit for elections and watching what's happening.
So Chelsea, are they getting rid of those bulky voting machine things that no one ever uses, or that's still?
We'll see. The topic of the county choice for election equipment, there's a file out there that we're hoping will move along. So.
Mr. Chair?
Commissioner
Chelsea,
Zelinski.
can you expand on security money?
Sure.
What kind of money are we looking at? Are we looking at 1,000,
No,
10,000, 100,000?
There's millions of dollars, and I don't
Millions?
have, I think there's millions of dollars that the state has, it's HAVA money, for security to utilize. And we haven't been able to touch it. It's kind of sitting in a special account, probably gaining interest, but we haven't, at the county or at our level, been able to utilize it for security.
Sure.
On elections. So we're hoping to see that happen too.
Could write a novel on what's going
I'm confident.
So just a little update on that. Any other questions? Nope. Okay. Thank you. So the next thing on the agenda that I have is firework permit, the first one for the year. We have application looking for approval today for Central Minnesota Council of Boy Scouts of America to hold fireworks at the Camp Ripley site on May 18th. The sheriff has already approved this application, and the required application fee and insurance has been received.
Gentlemen, I'll ask for a motion and a second.
Make a motion to approve.
I got a second. Any more discussion? Does Camp Ripley approve this too? If it's out in Camp Ripley, I'm assuming they would, right?
The sheriff has been in contact with the marshal as well, so they have good communication.
All right, I have a motion and a second. Any more discussion? Not those in favor?
Aye.
Opposed? Motion carried.
And the next thing I have on the agenda is the warrants to pay the bills.
Mr. Chair, I'll make a motion to approve all of the bills.
All right, I need a second.
Second.
Any more discussion? Not, this is a roll call vote. Commissioner Wilson?
Aye.
Commissioner Blaine?
Aye.
Commissioner Zelinski?
Aye.
Commissioner Lemire?
Aye.
Myself is aye. Motion carried.
Thank you, that's all I
All right.
have.
Thank you.
Chelsea, have a
Thank you,
good day.
Chelsea.
Thanks.
Keep
You guys
smiling.
too.
Steve, Public Works. And your guest? Hey, John.
Who is this
Morning.
Morning, Steve. Good morning, John.
Morning.
Good morning, everyone.
Morning, Steve. Morning, John.
Morning.
Everyone knows our Public Works Maintenance Superintendent is here to help with the second item that we have on the agenda. So the first item for your consideration is the last contract that we have for a transportation improvement plan for 2019. It consists of culvert replacements on County State Aid Highway 8. Could we go to the map, ma'am? Deb, could we go down to the map?
I'm sorry.
It's all right. It's okay, Deb.
The other direction, sorry.
It just takes me a little bit.
There you go. So we will be replacing centerline culverts on County State Aid Highway 8, the segment running from Trunk Highway 27 to our County State Aid Highway 51. Along with that, we have two other structures that are qualifying bridges on County State Aid Highway 34. They're kind of on the bottom of this map. Those are also included in this contract, one down at Gutwell's Corner, which is a replacement at the Rum River, and then I believe the other one just outside of Buckman is on Quince Creek. So we received 5 proposals, with the low proposal coming from Marvin Treader Incorporated. And we would recommend that the board adopt a resolution and award this contract to Marvin Treader Incorporated for $847,323.20.
Gentlemen, I'll ask for a motion and a second.
So move.
I got a motion and a second. Any more discussion? This is a roll call vote. No more discussion. Commissioner Blaine.
Aye.
Commissioner Zelinski.
Aye.
Commissioner Wilson.
Aye.
Commissioner Lemire.
Aye.
Myself, aye. Motion carried.
Thank you, members of the board. Mr. Chairman, members of the board, our second item, as the board is well aware, that the department utilizes substantial amounts of gravel and earth materials in the work that we do. We've discussed on numerous occasions the availability of gravel resources and what seems to be happening with those gravel resources across the county. First of all, there's been huge infrastructure improvements over the years that have utilized gravel resources throughout our area. We also have development encroachments that make it more difficult to open new resources if they're available at times. But also, we are seeing that our commercial operations are acquiring properties, and they are preparing themselves for the long-term and future use and ensuring their long-term viability as companies. And in our conversations, we have discussed when opportunities present themselves to see whether we can work out terms and conditions that may be beneficial to the county in terms of acquiring property that would be able to be utilized in the long term for gravel resources in the work that we do. We have some of that that's already occurred for Morrison County. Of course, the landfill is the largest one where we have a real substantial gravel resource, and that is kind of our core there. We operate in a number of different directions out of that facility. It has a substantial gravel resource. And then we kind of look at the outlying areas where we'd like to try to develop satellite areas for materials so that the hauling costs and the distances that we have to travel with that are reduced. We did obtain a 40-acre parcel in Scandia Valley about 25 years ago, I suspect is how long that's been, which is another source that we have on that we utilize, and that takes care of kind of the chimney of our county up in Scandia Valley and the townships surrounding that. Also, one of our strategic imperatives talks about updating our operations and restructuring as appropriate to ensure that we're meeting present and future needs of our residents. We believe that obtaining properties with gravel resources for the long-term use is in the best interest of the residents and the operations of our department. So there's an opportunity here that has presented itself. John is here. John is our maintenance superintendent. He has done the work in negotiating a purchase agreement that would allow us to determine materials on this site. He'd like to review that purchase agreement with you, and then we'd like to discuss whether you want to move forward with trying to obtain it.
Yeah, so I've been working with this private party on the purchase agreement. So in negotiations, I allowed them farming rights to their fields that currently exist for 5 years, and then that sunsets. The purchase price is $325,000 for 65 acres. Now, there's a number of contingencies on this purchase agreement because we need to go in there and on your last page, and we need to explore to see what's there. We visually can look at the land, but we need to make sure this is something that will work out for our department. So based on this purchase agreement, We are going to explore excavations to determine the quality and quantity of the gravel resources on the described property. The buyer shall have the sole rights to determine the location and depths of excavations. The buyer shall be responsible to restore the exploratory or excavation areas to the prior pre-excavation condition. And the buyer shall have the right to terminate this purchase agreement if the buyer's determination of the gravel resource on the property is inadequate. And then we will cover the survey cost, and also this purchase agreement is based on board approval. So if you approve this today, our next step would be go out there and explore for gravel, and if we determine there's adequate sources on this property, then we'd like to move forward at that point.
So that would be what we're proposing to the board for your action today?
Gentlemen, I'll ask for a motion and a second for this purchase agreement.
I'll make a motion for further discussion.
I'll second that.
All right, any more discussion? This will be a roll call vote, so any more discussion?
Mr. Chair, the fact of life is that Morrison County uses gravel. We have roads that we gravel, we have roads that we tar. I think another fact of life is there's only, I better be careful, gravel is in somewhat of a limited supply. I'm certainly not saying that every gravel pit in the country is empty, but gravel is in a limited supply. Once it's gone, it's gone. And this is an opportunity, I think, for the taxpayer in Morrison County to buy into something that we probably aren't using today, the full value, if you will, but we certainly will over the contract, if everything turns out the way that John's saying, that if there's resources available there, that we're going to spend this no matter what happens at the end of the day. So I think for me, that's let's take a look at it.
Commissioner Romero, did you have a comment?
I've got a question.
Commissioner Wilson, excuse me.
John, there's a pit open there right now, if I'm not mistaken, correct?
Yes, correct.
So does this land include that pit?
It includes that pit, plus it surrounds the pit going to the south and to the west.
Okay, so
And we currently have an existing gravel pile. We have crushed in there before for our own resources, so there is a pile in there right now.
So that would be available to us immediately once we find that there's enough gravel there and so forth. We'll be able to take gravel out of there. Even though you're waiting the 5 years on that farmland, we'll be able to pull gravel out of there on the other part.
Yes,
correct?
absolutely. I think by the time we get to the field, we'll be beyond that 5 years, that sunset, when we get to that point. So there shouldn't be no interference leaving them farm their current fields.
Thank you.
I have one comment.
Commissioner Lemire.
Yeah, John, and this is for our sole purpose of county use. We're not going to be selling it to individuals to compete with others that do this business, correct?
Our normal, and how we operate our other sites, we will work with a township or a city, but we will not compete with private enterprise.
Very good, thank you.
Any more discussion? Again, this is a roll call vote. Commissioner Lemire.
Aye.
Commissioner Jelinski.
Aye.
Commissioner Blaine.
Aye.
Commissioner Wilson.
Aye.
Myself, aye. Motion carried.
Thank you, that's all we have.
Thank
All
you.
right, thank you,
Thank
gentlemen.
you, John.
Have a good week.
You too.
All right, let's see here. Looks like Administrator Deb.
Mr. Chair, I don't have any formal action items for your consideration. Just wanted to let you know that we're still on track to have our first board meeting over at the, over back home on the 18th. We may have the planning session the week prior as a kind of a trial run. I think everything should be ready by then, but I don't want to make that promise as of yet. But that is the goal. Things look good over there. We're still working on the boardroom and then cleaning. We went through the punch list the other day, and that work will be done in the coming weeks. The 20th is when furniture will start to be delivered. That'll take a couple of weeks. Administration is scheduled to be moving that first week in June, and then midweek, social services front desk will occupy the area. That's now our area. And then the following week, the rest of the staff will be moving down. We have some furniture juggling to do because there are, in the individual offices, there are a lot of existing furniture components that will be used to furnish those areas. So it'll be a little bit of juggling, but we should be ready, and I'm excited for that to happen.
We'll have an update IT in the boardroom. Everything will be nice and up. IT.
I hope so, and we'll get training, and we'll see how it
Things like this
works.
are just not going to happen anymore.
Well, you know, and the Little Falls got a new system, and any new system,
Absolutely.
you have your kinks, and
Fact.
Mark still can't see it the way he wants to, but we're working on it here. So sorry about that. But yeah, I'm hoping that everything runs smooth and we have equipment that can work
But
for
that's why I
us.
brought the point up that things do happen even if it's new.
Oh, absolutely,
Matter.
absolutely.
Things break. It's just how it works.
Other than that, I'm not certain
Anything for Deb?
where
at all,
you guys are
gentlemen?
at, if there's anything for me, otherwise there's always a lot going on.
And we could take a tour of this place before it even gets there for somebody who's
Absolutely,
interested
stop
in
in.
it. So, are we gonna have a public opening for that? Yes, no, maybe?
Tabitha and I just talked about it this morning about meeting. I think the 18th we'll do a little open house at the first board meeting. Certainly invite, the public's always welcome, but have a little bit of a, spend some time just acclimating to the space and letting folks ask questions and see it if they'd like, and come in for maybe some coffee and whatnot, and visit prior to the meeting starting or right after. Haven't decided that yet.
And again, could you give us a little, how's the parking going with this construction with 27? How's that
Well, it's
working
not
out?
closed yet, right in front of the building. When that happens, which is what date is it today? The 13th, next Monday. Is that next Monday or a week from Monday? I got to look at the date. Next Monday.
Next Monday is the 13th.
I believe is when that's scheduled to be closed, and the city's going to post, stripe, whatever, or combination of both, that north side of First Avenue, so directly in front of the building, the parking lot, the U, and that whole length of the street from 4th until 2nd. They are going to have that be no parking. And the reason is because the ability, right now, if you're in the parking lot and you want to exit, it's hard to see with cars parked there, very hard. You have to almost get all the way into traffic to be able to turn out, whether you're going east or west. And so looking at that and knowing that there'll be more traffic to accommodate for that detour, because that's where it's running, the solution was to have that be no parking so people can see. I just think that's going to be safer. And so did law enforcement. Sean weighed in along with Little Falls PD and then the engineer and the project folks. And then actually moving forward to trying to look at what the best access is in and out and how much parking is a good idea. And after we sat there and talked about it, our emergency vehicles are flying in and out of there, right in front of the sheriff's office, right directly south of that having parking there at all, I think we're going to find the ability to see is going to be pretty nice, I think, in terms of safety reasons. And so we'll see if that happens long-term or not. But for now, certainly for the detour time and the construction season this summer, we're going to be having that be no parking. Good question. It limits it. I've talked to staff. We'll continue to update them to make sure they're adhering to that. It's important to leave access to customers so they have plenty of room and space on a typical day. Sometimes we have a lot going on and parking's hard for everybody, but we certainly are aware of that and trying to do the best we can to accommodate it.
And I just put that out there for the record that, the north side, there will be no parking in the courthouse.
That will be a change. There's probably room for maybe 10 cars on the main part and a few in front of the sheriff's office, so that'll limit some parking options.
Anything else for Deb at all, gentlemen? Otherwise, committee reports? How about, let's start with Commissioner Lemire.
What dates?
May 12th through May 25th.
12th through the 25th of May.
13th, Yellow Ribbon, 5:30 at Cabin Fever. 14th, planning session. And 21st, board meeting. What'd you say, Sue?
25th.
Okay, that's it. That's all I got.
All right. Commissioner Wilson.
Okay, I've got a township meeting where we're meeting with the townships on planning and zoning stuff. I've got one of those on the 15th.
Which township? Which township? This is just individual townships. You would not be
your own.
Yeah,
Yeah,
our
your
own.
own.
Yeah, I don't know. I've got to look
Okay.
and see. But I have one that night.
What time is that one?
It'll be at 7:30.
It's going to be one of the townships in
I've got it on
Mike's
my
district.
phone, I can look it up if you need to know which one. Is there something with AMC on the 16th? Anybody got anything on that?
The regional meeting, right?
No,
The 16th?
Yep.
No.
Is it?
Is that next Monday, the 13th? Is that, no,
that's in the regional
June?
meeting, when is, that's in June, I think.
June 10th, never mind.
Okay, there's nothing for AMC?
No, not until June.
Okay.
Not that I know of. No.
That's the one in Kennebec County you're talking about.
Or
I
Kennebec,
just had
depends on which way
AMC
you
on
go.
here, so. Community development I have on the 20th, Tabitha,
Okay,
at 12:15.
on the 20th, which is Monday.
Deb.
And the
You do bring on
24th, I
laugh
have
once in a while.
Mississippi Headwaters.
At 9,
Yes,
and where is that one held?
it's in Walker. It's at 10. And the 25th, isn't that Lake Chaminade Association?
That is the association's meeting.
Yep. Yep.
I
It's
won't
not
be
the lid,
attending that.
that's not the lid.
So we do not need to attend that one, really. I mean, not the rest of us.
No, there's no
Okay.
action item that will come from that meeting for you at your table, so,
Okay, sounds good.
how's that?
That's all I got.
Just identify, Lake Association and lid are two different things.
Yes.
so.
And we don't have to go to either one of them
No,
if we don't want to.
Right.
That's the.
Okay, so you good to go, Mr. Wilson?
Yes, I'm
Commissioner
done.
Blaine?
On Wednesday, May 15th, I have a board meeting for evaluation with the CEO at the Region 5 office for Region 5. And the only other thing I have is a Region 5 meeting on Thursday, the 23rd.
All right.
Otherwise, I'm covered. Thank you.
Okay. Commissioner Zelinski?
Mr. Chair, if I can go back in time just a little bit, tonight, I'm going to start off Township Board meeting with Land Services after the Board of Adjustments meeting.
Which township?
I'll be at Ripley Township at 8:30 tonight, just for
For the record, good point.
for information. Monday, the 13th, at 7 PM, I'll be at Boo Township with Land Services. The 14th, Tabitha, Towards Zero Death has been canceled. The 15th at 5 o'clock, I have a Hands of Hope meeting, and here in Little Falls at, I believe, Pine Country Bank. On the 16th, at 10 o'clock in the morning, I'll be in Alexandria at an Armor Owners and Operators meeting. 7:30 that evening, I'll be at the fairgrounds with the Egg Society. The 19th starts EMS week. Board on the 23rd at 12:30 in the afternoon. I'll be in St. Paul at the SECB at an Armor meeting. And that's all I've got.
All right, thank you, Commissioner Zelinski. Those are good. On the 20th, I'll be meeting with the Little Falls Township at 6:30 with Land Services. On the 21st, Great River Regional Library on Tuesday at 5 PM in St. Cloud. On the 23rd, TCC, Tri-County Community, 5 PM here in Little Falls. And then on the 24th, Soil and Water here in Little Falls, SWCD at 9 o'clock. And that covers me. Anything else?
Tabitha, my meeting is for Pierce Township.
Mr. Chair, I'm going to move to adjourn.
All right, I got a motion. I need a second? I got a motion, and a second. Those in favor?
Aye.
Adjourned.